Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Sufra FM, tell a friend, call your neighbor. Casualty 911 is on.
Good morning and welcome to another edition of Casualty 911 on 88.5 Sufra FM this very rainy morning in Sufra. And I hope that it is a reminder to all of us that we are in the hurricane season and we no longer will just be reluctant to do whatever is necessary to get ourselves ready in the event that we have some kind of weather issue. It does not necessarily have to be a tropical storm or a hurricane. We know that water can be very damaging when it comes in very large quantities in a short space of time. So that is a rainy welcome to all of our listeners. For those of you who are regular listeners and joining us all the time, welcome. For those of you who are joining us for the first time, a very pleasant good morning to you. This morning, we have a very special guest with us. We will be speaking about something that only she, I don't think I can even help to explain. So Dr. Gomez is here with us. She will be speaking about events-based surveillance. Dr. Gomez will tell us a little bit about herself before we get into the topic. But events-based surveillance, we will be looking at what events would be under surveillance, who would be involved in that surveillance, what is the importance of doing that surveillance to begin with, and what is going to be done with the information that we get from doing that surveillance, among other things. So welcome, Dr. Gomez. I'm not quite sure if it's your first time on the program, but
Yes.
welcome. Good morning and welcome. Just tell us a little bit about yourself before we get into delve into the whole issue of events-based surveillance.
Okay. Good morning, one, and thanks for having me on the show this morning. So, well, my name is Dr. Gomez. I am a medical surveillance officer at the epidemiology unit in the Department of Health, the Ministry of Health, because we have several units in the health ministry. So, epidemiology is one of those. I am a general practitioner by trade, and I've been employed with the government for quite some time. I have been working in several areas. I have worked in several areas, including the hospitals, the community, and now I am at the epidemiology unit.
Okay. So, Dr. Gomez, thank you for that. I think we're having a little volume issue. I don't know.
Okay.
You can come a little closer or increase your volume a little bit.
Okay, no problem. I've been told so many
Wonderful.
times.
Pardon?
I've been told so many times, so I will try to project.
Okay. So let us start off with what exactly is events-based surveillance? So you're in the EPI unit. Maybe we should start off with what really does the EPI unit do? What does the epidemiology unit do so that we can then segue into what is events-based surveillance? So what do you do as a unit?
Okay. Well, actually, I was going to start off with that just to give persons a bit of
Okay.
context as to what the EPI unit is. So the epidemiology unit, like I said, is one of the units within the Ministry of Health, and one of the functions of the epidemiology unit is the monitoring of diseases that affect the population of St. Lucia. So when we collect information on the diseases based on the clinic visits, persons who come to the health centers, the hospitals, and we analyze that data, and we're able to inform the people of St. Lucia as to what is occurring on the ground, what we're seeing, and in turn be able to inform programs, as we have many programs, maternal programs, child health programs, to see where are the strengths, where are the gaps, how we can improve this program. So that is one of the functions of the epidemiology unit.
Okay.
So in monitoring diseases, we have two systems, which forms part of our integrated surveillance system. We have the indicator-based surveillance system and we have the event-based surveillance system. So this morning we'll be speaking about the event-based surveillance system. The event-based surveillance system is basically when we receive information, we collect that information, we monitor the information, and we assess that unstructured information about possible health events or risk which do not come from the traditional healthcare facilities. So it's basically receiving information, the ears on the ground, receiving information from rumors and whispers and from community members who may be seeing something unusual that is happening instead of waiting for the persons who go to the clinic visits or the clinics and the labs to report to us. We basically getting that information from on the ground. Why is it is important to us? Because our island is a small island and we do know that before a disease actually reaches the hospital or the health center, it starts within the community where persons are seeing that something is happening and they can report that to us. We've had event-based surveillance around for some time, but we've put it into a formal structure where persons can report to a certain place and then we can pull out that information and see what is happening. With the indicator-based surveillance system, which is our other surveillance system, that the two of them form this integrated surveillance system. The indicator-based system is basically within the healthcare facilities, at the hospitals, at the labs, and it has a formal structure where you have data collection tools or what we call a reporting form that the healthcare professionals fill in the form, and which is basically online right now. Before it was paper based, but now it's online and it's digital, so we get that information in real time. Probably persons who've gone to the health centers, most persons know that when they enter the health center, their information is put into an electronic system, and through that electronic system, when the information is put in there, we at the epidemiology unit can pull out that information, whatever it is, and be able to analyze the data and see what's happening on the ground with the population. So it is very important to us that both systems work together, both the indicator based, which is the one that exists within the healthcare facilities, and the event based, which is the one that the community member, will be calling to us and letting us know what's happening, that these two systems work together so that we have a clearer picture of what's happening within the health system in St. Lucia.
Okay. So when we speak about the community, when we hear community, some people may feel that they're not actually the ones who should be reporting. So is it for everybody? Are there also, for example, organizations that you would consider, for example, schools and maybe clubs and so on, that as entities within the communities that they can also report as well as individuals?
Yes. So with the event-based surveillance system, anyone can report. We have our 311 call center that persons can dial that number 311 if they see something unusual happening within the communities. For example, the other day we had an individual call out to us saying that they saw some chickens and some dead dogs near a garbage bin. So, of course, this is something that's unusual to him and to the community. So, we had to liaise with the vet department, and they went out, they investigated, and they found out that it was a case of of poisoning. So that individual reached out to us, and we were able to go out and investigate and ensure that the community was safe and it wasn't any disease that was affecting the animals, because diseases that affect animals can eventually pass on to human beings as well at times. So we investigated that and we found out what the source was. Of course, with event-based surveillance, we have extended it a bit more, where we have the community-based surveillance, where we have particular persons or focal, what we call focal points within the different health regions, because for health, the St. Lucia is divided into 8 health regions, and we have persons in each of these regions who act as our ears and eyes on the ground. In addition to, if a community member who sees something unusual can call 311, the focal points also serve as our another safety net for reporting as well. But we do have other sources of information for EBS. We have the media is one, because a lot of things are posted on social media, the TikToks, the Instagram. We can follow that as well. We do have, in addition, the schools as well. One of our focal points is happens to be an educator as well, and that individual was able to alert us as well of something that was ongoing, that they alert us of children, for example, if there are children, high absenteeism in school, children not coming to school because they have respiratory illnesses. So again, we were alerted of that, and we were able to go in, investigate, get the parents to bring the children to the health center where they were tested, and we identified that it was influenza that was circulating, and we were able to put in the response measures, increase hygiene, making sure that the children are well before they go back to school, and certain response measures that help to prevent the further spread of the disease. So in addition to the schools, we also have the workplaces that can also report. Also the pharmacies, they are the ones where persons, a lot of the times, persons do not come to the health centers. They go to the pharmacies, they do their own concoction at home, they drink their paracetamol or their bush medicine or whatever, and they do not go, they go to the pharmacy. If, for example, if they have a diarrhea or cough and cold, they go and they get some rehydration salts, some Imodium for the diarrhea. So if the pharmacy see an increase in sales, they also will alert us as to something is happening. Hey, we should try to investigate, and that's what our response is. So we have collaboration with many different sectors, not only within the health care facilities, but also with other sectors, the schools, the workplaces, the pharmacies, the media, etc.
Okay. So all of those people would be calling the 311 to report. Is that the only way to report?
So the 311 is our, well, it's not the 311 contact center. It's not a call center, it's a contact center. So this is one of the ways to report. So the information will be put into a digital system. And again, similarly to the health systems, we are able to extract that information on a daily basis. We go in there to see if there's anything to report. We have gotten reports of individuals reporting that they have increased sightings of mosquitoes. So we can divert that information to the Department of Environmental Health, and they will take the necessary preventive measures in terms of the entomological surveillance and whatever else that they have to do to prevent, of course, because this is the rainy season, so we're looking at our mosquito-borne illnesses such as dengue, Zika, and chikungunya. So we've had reports of that, the 311, and if so, any community member who sees something unusual can call the 311 contact center. And in addition, we have our community focal points, because of our community event-based surveillance system that we have, and they themselves can report to us anything that is unusual.
Okay. So how would a community member decide whether it's worth calling the contact center to report? Or,
Okay.
or are you not concerned that maybe you will be overwhelmed with a lot of calls that don't necessarily fit what the information you're trying to capture?
So we have had that discussion with the members of the 311 contact center. So we have trained them. We have a manual. We have our standard operating procedures for event-based surveillance. So it's a system, and we have procedures as to what can be considered a signal. So once the caller contacts the center, the individual on the receiving end would, based on the training that they have received, they would know whether this would constitute a signal or not. And once this is put into the system, we go in and we will be the ones to verify whether it will become an event. Yes. So we also have a couple of posters that we have developed, and we have distributed on our Ministry of Health web, not website, the Facebook page, and we will be also putting up the posters in several strategic locations so that individuals can be more aware of the event-based surveillance system, and also where to call and who to call as well.
Okay, great. One of the things is that our health system is public and private. So,
Mhm.
would the private sector fall under the indicator based or events based, and how does that work?
So the private sector falls under both. In the past, we work closely with the private sector. We have our communicable disease manual, which has the notifiable diseases. Notifiable diseases meaning that there are certain diseases that once it's detected, it has to be notified or it has to be reported to the health institution. Dengue is one of those, chikungunya as well, because of the public health significance that they have, meaning that they can cause a lot of um, absenteeism, they can cause a lot of long term issues. So, therefore, it needs to be reported to the healthcare facilities. So, the private persons, a lot of the times they reach out to us and they let us know, okay, hey, something is happening. And because they're seeing an increased number of persons coming in with certain symptoms. The labs do the same. As we also do share, they share information with us, because again, since we have the notifiable diseases, as it is their mandate to report to us any disease that is on that list, and has to be notified so that we can again mount the necessary response. They have been instrumental in doing so, especially for outbreaks. For example, the dengue outbreak, which happened in 2020, and we also had one in 2024, which was not as big as the 2020 outbreak because we also had COVID-19 happening at the same time. But they also given us information, because if a lot of persons do go to the private facilities, in as much as individuals visit the public health institutions, they also visit the private health institutions. So having information from both the public and the private would give us a better um, analysis or report of the situation of what is happening on the ground as well. So in the past, we've always worked together, and again, do as we have the notifiable disease list, they also need to report to us. But we work hand in hand when it comes to the detection of diseases.
Okay. So we've talked a little bit about what the events-based surveillance is, and also who can report and how they can report. You've also shared how some of that information would be used. For example, you noted that when it comes to the reports that you received about the mosquitoes, then you would divert that to the Environmental Health Division, which is a division that deals with what people like to call the fogging. They always want to see the fogging happening. They
Yes.
don't really care whether there's dengue or anything. They just want to get rid of the mosquitoes, and they
Yes.
want it to be done by fogging.
Yes.
So, in as much as that is not always the best response,
Mm-hmm.
but but we know what the expectations are on the ground. But that system appears to be quite complicated, and it in terms of uh, the volume of information that you will get, and
Mm-hmm.
how you do the surveillance in terms of, say, for example, the media, is that surveillance being done manually, like going through different media outlets, and reading through social media, or is there, technology is a thing that, there are tools. I'm sure, pretty sure there might be tools out there that I'm not aware of. So how is it
Mm-hmm.
being done? Are we using the technology, or are we doing it manually?
So for the media, usually our reports come from the education unit. The
Pardon?
for the education and communication unit, they are
Okay.
the ones because they basically deal with the media. So the information from the media comes to us through them. So they would inform us or give us a heads up as to what is occurring. And based on that, we would be the ones to verify what is happening on the ground. Um, in other instances, like I said, individuals may call up to us because they know us personally, and they would call up to us. But for the media reports, um, it would the education unit has a very big role to play in detection of any signals coming from the media.
Okay. And what about third party reporting? We have a he say, she say culture.
Mm-hmm.
So
Yes, we
somebody
do.
might have heard somebody talking about something that's happening somewhere else, but they don't have the first-hand information. However, the
Mm-hmm.
person who has the first-hand information is not really willing to call. Can that third party now call, and do you think would they be in a position to be able to actually to give the necessary information?
So we do expect that with the reporting of signals, um, not everybody would know what it is to report. That is one of the reasons that we have the criteria for what it is, and we have that process of verification. So for
Okay.
each of the health regions, we have our teams. We have several teams in each region, which composes of the public health nursing supervisor, a Bureau of Health educator, an educator. We have also a veterinary person on there, maybe an agricultural officer. So persons from different sectors. So we have that collaboration. So once a signal is received, you need to verify that it is true or not. And the one way of doing that, if it's coming from a particular community, because when they give in the report, they need to say where it is happening for us to be able to verify that it's actually happening there. So once we receive that report, we go into the region where that community is located. We collaborate with the team on ground to ensure that something is actually happening, whether they, like I said, they may not be coming to the healthcare facilities because we do have a habit of treating things at home, especially, for example, if it's a case of gastro, persons who are at a party and they end up having vomiting and diarrhea, persons will just say, okay, it's a case of food poisoning and do their own thing at home until it's a case where maybe an elderly or a young child becomes dehydrated and they end up in the hospital, and you might end up, when it gets to that far. But for the most part, this is the process that we take. Once the signal is received, we go back to the health teams in within the region, the regional teams, to ensure that there is verification that this is actually happening. And once we verify that is happening, then we go in and we um, see what's happening to an assessment, so that we can mount the necessary response. So this is what we actually do with the event. So we're not responding to everything. Um, well, it's kind of like responding to everything, but it's basically verifying that we don't mount that the total response. We verify first, and then we have our activities, which would comprise the formal response to that event, if it is an event. So it starts from a signal verification, it becomes an event, and then that event we will get a response to that event. Yeah.
I guess you would respond based on the severity. The
Yes.
level of the response would depend on
Mhm.
the severity of whatever the situation is.
Yes.
Yeah.
So that is why the
So
team comprises of many different persons from different sectors, depending on what, it's something to deal with animal health, then we have a vet. If we need the agricultural sector, so we need an agricultural officer, depending on what.
so that's the second time you've mentioned animals. So we are reporting both human and animal.
Yes, yes,
We
because
are
we have that
reporting both human
collaboration.
and animal. And can you tell us a little bit about why it would be important to report about animals as well?
Well, it's important to report about animal health because 60% of diseases are zoonotic, or animal, they come from animal waste, and can be transmitted to human beings. So let's take something that we have on in country, for example, leptospirosis. Leptospirosis is one of the common diseases that we have um, in country, and a lot of animals do suffer from leptospirosis. But a lot of people do, when they hear leptospirosis, all they think of is rats. Yes, rat is the common source of the disease, but other animals can also suffer can be infected with leptospirosis. For example, your dog that you have at your home, your cats can also be infected with leptospirosis. We have had cases of dogs having leptospirosis, and then the veterinary person calls us up to let us know, okay, we identified a dog who has leptospirosis. Ensure that in that case, we on our human health side have to go and check on the persons who have the dog to ensure that they have no symptoms either. So this collaboration is very important. So that is just one of the diseases. And
Let's stay on leptospirosis for a little while. I think it's very timely, and I like the fact that you mentioned leptospirosis because we are in the hurricane season. We have a
yes.
lot of rain. And this morning, actually, I was standing under a building shelter in the rain, and there was
Hmm.
this young girl. She took her foot right in front. We were right in front of a drain. There's a lot of water, and she just pushed her foot in the drain, played in the water a little bit, and then pulled her foot back out. So I would like for you to just elaborate a little bit about lepto. You don't have to go too, I mean, briefly. I would
Hmm.
appreciate it. And so that we can understand what's happening with that whole issue of animal to human.
Okay. So leptospirosis is actually a bacterial disease. It is harbored in several animals, rats included. Uh, it is transmitted to human beings through the urine of that animal. So, for example, if the rat passes by and it urinates on your counter and you don't wipe the counter, you end up preparing your food there. This You can get leptospirosis. We have had quite a few cases of leptospirosis in the past. For example, when I just came into the department in 2017, 2018, 2019, we had basically, you could call it an outbreak of cases of leptospirosis, where we had an increased number of cases during that period. We did understand. We knew why it was happening, and we had to work with the necessary persons within the different sectors to ensure that it will not continue, the spread will not continue, and the outbreak would not continue. So that has happened, and we don't have as many cases. We probably get maybe about um, 8 cases, 8 to 10 cases per year, but not in the numbers that we were getting in the 20s and 30s as in 2017 and 2018. Um, so what happens is that with leptospirosis, if you have poor garbage disposal, then it increases the number of rodents around your home. For example, if you feed your dog at night, sometimes the dog might not eat all the food in the bowl that is given to them, and the rats come around later in the night. And if you walk barefoot in your yard, the rat has urinated in the yard, and there's a possibility that you can become infected with leptospirosis. Or you touch the bowl, the rat has urinated on the bowl. Even the dog can get leptospirosis as well from the infected urine of the rat. So it's very important to have proper garbage disposal practices and not just throw your garbage anywhere. So throwing your garbage um, a little away from your home at somebody else's home mean that the person where you throw in the garbage will have rats at their home, which is something that is basically happening in the area where I live, where persons are disposing of their garbage.
Really?
Yes, yes. So
In
they
other
come to my
people's yard?
area. Yes, and they throw it. Well, it's not in somebody else's yard, but it's
Okay.
across the road from me. So persons are
Mhm.
disposing of their garbage in that area, and of course, it is causing rodents in my area because it's garbage like remnants of food and stuff like that. So ensure that you have proper disposal of your garbage. If you have peelings or food that has been left over, just freeze the garbage until the day of garbage collection. So garbage disposal is very important. And if you are walking in your yard, ensure that you have shoes. Feed your dog in the morning or your animals in the morning so that there's no food left over during the day. And for example, persons who do landscaping or the farmers, ensure that you have your proper PPEs, which is your personal protective equipment. Use the use of the boots, the use of your hand gloves to do your weeding, which will protect you because we always have rodents. There are always rodents in the field and they're urinating and persons. And we did find quite a few of the, not quite a few, a lot of the persons who were infected, some of them were also not they were not farmers, but they would have some degree of agricultural practices in terms of landscaping, or they had a backyard garden or something to that effect. So these are common ways where persons get infected. Also, if you're bathing in a river, you can get infected with leptospirosis because the rats are very good swimmers. So they can also urinate in the water. So when you bathe in that can happen as well. Or if you're wading in dirty water, if there's a flood and you happen to pass in the water, that can also cause, like Fauna was saying, the young lady passing her foot in that dirty water. You don't know where it's coming from. Rat may have urinated in there, the feces in the water that can also have the bacteria, and you can end up getting infected with leptospirosis. Okay, so these are the treatment for it. A lot of the cases that we have, they end up in hospital. They need to be treated in hospital. So again, that is days that you will be losing loss of productivity. You will not be going to work at that time. If you have to provide for your family, that's also of concern. It does affect the kidneys, but can cause acute kidney injury. In a lot of the cases that did happen, but it's something that's reversible and it was treated. And it is because it's a bacteria, it is treated with antibiotics. Most persons do recover from the disease. In some instances, it can be fatal and persons can die from it, especially if it is detected late, just like dengue. But in our island in Saint Lucia, a good thing our doctors, they have a high suspicion. So when persons do come in, they tend to check for all of these things. So a lot of the persons, they treated in hospital and they are discharged home alive. Yes, if I may say so. I don't know if I missed
So
out anything that you would like to add. Right.
thank you for that, Dr. Gomez. Thank you for that, Dr. Gomez. So I thought it was actually just a very good opportunity
Mhm.
to help people to understand why we shouldn't, do certain things. And you had already mentioned the leptospirosis, so that was a very comprehensive explanation. And the thing about it is, when there are cases, we think about those things, but once it's like out of sight, out of mind. We don't
Mhm.
hear about lepto. We have not been hearing about lepto for a while, so it's like we forget those things, and we just do things as we say, Vicky vibe. We're just doing whatever we want. Okay.
Business as
You
usual.
also mentioned gastroenteritis.
Mhm.
Hold on. We also mentioned gastroenteritis. So we, that is one of the issues that tends to come up, especially when we have mass events,
Mhm.
and we are in the season of a lot of events. So, if, for example, I go to a fete and my whole family gets sick because we bought something somewhere, should we call 311?
Yes, you can. Yes, you can, because it is quite possible that it could be something that is foodborne. And if it's foodborne, what we normally do in cases of gastro, um, if somebody reports a case of gastro and they say that one of the questions, we have certain questions that we ask, and one of the questions is, were you at an event? If you say yes, you were at an event, then we ask you what event you were at to be able to trace back. In addition to that, we also do ask you what food did you consume at least um, 48 hours before the event, or if in asking the questions you can probably summarize, okay, that most likely the event caused the gastro, the food consumed at the gastro caused the event. So in taking the food history, we could pinpoint what food might have caused that, and we can go back to the individuals who prepared the food, because it's very important to prepare your food properly. And we do know that there are certain foods that can lead to gastroenteritis. Um, Persons know that as well. For example, um, the fig salads, food that has mayonnaise that has not been, that doesn't have the proper temperature. Fruits as well can cause gastro if they're not at the right temperature. The salads, if they're not washed properly, these foods can cause, rice can cause that as well. I can give you gastroenteritis. So we ensure that we take a proper food history from persons, especially if it's more than one person within the household that attended that activity, or they know of other individuals who've attended that activity, and they can pinpoint, or they can let us know who these individuals are, so we can take a food history to be able to address the individual who's preparing the food and see which one of the foods might have been in their food preparation. And of course, we work closely with the environmental health department. So anytime there is gastroenteritis, any foodborne illness, we work hand in hand, because they would do the training aspect of it, in terms of training persons and the vendors, the food establishment, as to the proper food preparation practices, and maintaining the cold chain, and maintaining the food at the right temperature, so that it doesn't cause diseases to humans.
Now, Dr. Gomez, at the very beginning, you you said something. We're a small country, and sometimes people are very reluctant to call because they feel like they might get somebody in trouble.
Mm.
Okay, so what would you say to people out there who, for example, I have been in a situation where I went to, I ate at a restaurant, and the next day, several other people said they had loose bowel, either in the evening or the early morning, and so on. But none of us called 311. I don't know. We just didn't do it. And that probably was a situation where we should have called so that at least the investigation could have been done. And, to so that other people would not probably experience the same thing that we had experienced. But
Right.
there is sometimes that reluctance to call for various reasons. To
Yes.
report, not call, report. We don't want to report.
Yeah, that's the word that is used. We don't want to report. We don't want to be a snitch. But you said it rightly, so that other persons would not have the same fate. So calling 311, you don't necessarily have to give your name. So it can be anonymous. You can just report the incident or the signal, and then we investigate. So you don't have to give your name if you find that something is happening and you're not comfortable with it. It's unusual. You haven't seen it before. You can report and don't give your name. As long as you give the information of what the event is, the possible event is, and of course how for us to get there as well.
Okay.
But the importance of reporting is that sometimes you may cook something and the individual who has done the food preparation doesn't even know, or sometimes they may need a refresher. So there are many possibilities. In the end, it's going to help the establishment, the person who's preparing the food, as well as other individuals, so that they themselves don't fall sick. So you said it rightly. It will prevent other individuals from falling sick, and it will also help that food establishment. Because if you fall sick, if you go and buy food in a place and you fall sick, you say, "Boy, me, I'm not going back there again." Now that person, I ate a roti there and that gave me a good.
Exactly that.
So it will help their business as well. So persons don't have to look at these things in a negative light. They need to look at it positively as helping themselves and helping others as well. And not all anything as negative as I'm going to report, I'm going to be a snitch on somebody. But again, if you report into the contact 311 contact center, it's something that can be done anonymously. You don't have to give your name.
Okay, great. Now we have a question here. I will get back to it. It's about gastroenteritis. I will get back to it. But since we're on the topic of 311, what can a person expect when they call 311? So you call, and what happens? Are you prompted to get the necessary information, or do you just give whatever you have and then you will be, if anything is missing, they ask you?
The
How
persons
does it
let
work?
Oh, yeah. Well, so the persons who respond, the contact center respondents, they have been trained on the event based on our SOPs as to what to identify, and if needs be, because they are not medical persons per se, but they do have a little background based on the training, but we don't expect them, they're not experts. So they will ask a few questions, not too many, based on their knowledge and what has been given. And they will take down the necessary information, and we will do that verification process. Because we don't want it to be something that is too intense to them. So we want them to take as much information as possible, so that we are able to decide whether the signal in fact necessitates a response from us. Yeah. But yeah,
Okay.
so they call and they give in as much information as possible to the 311 contact center respondent.
Okay. So let's go to that question from a viewer. So Miss Nadia Casabon, who is from Soufriere, is asking, are there any stats on the cases or the incidence of gastroenteritis and leptospirosis in Soufriere?
So for leptospirosis, so far we have not received any cases. I don't know if she's reporting something. In terms of gastroenteritis, we have seen an increase in the number of cases of persons within Soufriere with gastro. That was for we saw the increase in cases a week before last. Um, so we are investigating to see what the cause might be, if it's something of an infectious nature. But based on the information that we get in, the symptomatology, the fact that there's a lot of vomiting, we tend to think that it may be infectious based on the symptoms and the fact that persons recover rather quickly. We think that is infectious. We've had a similar situation last year, sometime around March, where we saw an increase in cases in gastro within the population, and we were able to get stool samples from individuals, and it pointed to an infectious nature, which was a viral agent, which we call norovirus. I don't know if persons might have heard about norovirus, but it is a very common virus that causes gastroenteritis. A lot of the times on the cruise ships, they have outbreaks of norovirus because it spreads rather quickly amongst the population. If you have poor hygiene, poor hand washing practices, it's going to spread very quickly because if feces, yeah, it will spread quickly. And the symptoms are you will get the diarrhea, but there's a lot of vomiting as well, which entails you will get some abdominal cramping. It may last about let's say 3 to 4 days for the most part, and then it subsides with hydration or rehydration salts. Most of the times, you don't really need an antibiotic because it is a virus that causes it, and it has been known to in foods, for example, salads. The infection is can be passed on very easily through salads and raw
The
foods.
fresh salad.
Yes, the fresh
Fresh
salads.
salad.
Yes. So we are thinking based on the symptomatology, what persons are presenting with. We think it's possibly infectious. We have not seen an increase in cases apart from that week so far. But we are keeping our eye and continuing to investigate to get stool samples so that we can test to confirm that it is actually what it is. So we have our theory, but we need a stool sample to confirm. So if persons are in Soufriere listen and they do have symptoms of vomiting and diarrhea, once they go into the facility to look for care and not wait until it abates, we are asking that they provide a stool sample so that we can test, because you really want to find out what it is that is causing that and not just say, okay, I think it's this or I think it's that. You want to be concrete and confirm that it is actually this so you can mount the proper response measures. Although we have met again, we have the regional teams, we have met with the regional team and the clinical management team what to do. We have told the education team they basically doing the education increasing health in hygiene practices in the food establishment. Persons in general, hand washing is always very important. You cannot go wrong with that, especially after using the bathroom. Is hand washing is best. I mean, I was going to say hand sanitizer, but in this case, hand washing is best. And once you have soap and water, and especially for food preparation, ensure that your salads are well prepared and well washed and soaked properly, so that you don't have that perpetuation of the virus if it is in fact norovirus.
Okay. So I hope that answers the question for Nadia. I'm sure if she wants any further information, she will put a
Reach out to us.
comment. Yes, she'll put another question in there. So gastroenteritis, you talked about it because, as you said, it can spread quickly. And since we have so many events coming up, that's one of the things that we really need to bear in mind. I know that very often the environmental health division, when there are those big, that season of events, sometimes they have education sessions for the food handlers and the food vendors and so on. So I would just encourage everybody, if you are invited to come to the food handling session and so on, to go. Don't just think that you already know everything. Sometimes, you go and you pick
Mhm.
up on something else. There might be something might have lapsed on, but also for the general public, for us to be a little bit more vigilant. Pay attention to your surroundings. Look where it's possible to see what's happening, of course, because sometimes a lot of the preparation takes place behind the scenes and you just get the finished product. And
Yes,
once it looks
very
good
true.
and it smells good, we eat. Okay?
Yes, that is very true.
Yes. So let us just be a little bit more vigilant as it pertains to that. But I'm a little curious about the gastro that you mentioned in Soufre. Was
Mhm.
that, would you say it came in through the traditional indicator based system, surveillance system, or did you get any calls?
No, we did not receive any calls.
Oh,
We It came through the indicator-based surveillance system where we collect data on a weekly basis. The health facilities report to us, and we have our trends. And if when we go above those the trend for that week, we know okay that something is happening. So right away we reach out to the healthcare facilities. We reach out to the principal nursing officer and the healthcare team down there, the educator, because once it's gastro, we know that you have to have a preventive measure. You have to have a response from everybody. It's not just the clinical management team in collecting the stool samples,
yeah.
but you have to have the education aspect of it. You have to have the food and water aspect of it, as well as the clinical management. Um, so that's what we did, but it came in through the indicator-based system. So that is why we have both systems working. It would have been nice if somebody would have called us because I'm pretty sure that was
Yes.
probably occurring before um, we were able to observe it. So it's well, that is why we're here on the program today as well, to make persons aware that the 311 contact center exists and persons can feel free to call, and you don't have to give your name. You just give the information and we go out and we verify whether it is true or not that this is actually happening. Again, is to safeguard your community, yourself, your family, your friends, the community on a whole, because we're all working towards one purpose: prevention of diseases. It's better to prevent than to have the disease and then you're missing work, you cannot go to school, you're unwell. You might have a function that you have to attend and you cannot attend because you're unwell. Nobody likes to be unwell, so it is better that we
Especially
prevent.
with something like that.
Yes, you cannot find a proper toilet at the time.
Yes. And it's one of those diseases that usually, if people have gastro, you always hear people talking about, oh, there's something in the air these days.
Yes,
There's
yes,
something in the air. So people are vomiting, people have diarrhea. So it is really one of those diseases that should be coming through the
yes,
event based surveillance system, because
yes,
on the ground you hear people talking about it all the time. So basically, if you're in the community and you're talking about it, there are so many people who have it, you might as well just call 311,
yes.
the contact center, right?
Yes, and we were seeing is that most the ages that were affected were between 20 to 40. So it's the productive sector, That was, we had
That's
a
the
few
people that
pediatric
outline
cases.
in.
Yes, that too. So that's what we were seeing was occurring with that in that particular instance. We did see a couple of pediatric cases that did require hydration for sure, because with gastro, the two ages, the very very young and the very very old,
Yes,
can
very
end up being,
vulnerable.
yes, they're vulnerable and can end up being dehydrated. So you don't want that to happen. But I'm pretty sure that persons were probably having symptoms. But of course, again, they will go to the pharmacies and do their concoctions and probably get the
Yeah, or they
rehydration
drink their little
salts.
something at home
Yes, yeah, yes. The coconut water.
and wait it out.
Yes.
Okay. So I think we'll have one final question. Uh, what are what are some of the consequences of late detection? So if it's not picked up, if those events are not picked up early enough, what are some of the possible consequences to the general public and to public health?
Okay. So, like we said before the diseases comes to the health facility, it is happening in the community. So we know what's happening within the community. If it's not detected early enough, what we can have is an outbreak. We do have limited healthcare capacity. You know, our healthcare system, we have small healthcare system, so therefore our healthcare system can be overwhelmed at that point in time. So that is, and then it would affect our economies, because lack of persons, if you're unwell, you cannot work. So that would affect your economy as well. So it is important to detect diseases from early on, to prevent the spread of the disease. So that is that is what we're trying to do with event based, by putting persons within the communities and allowing the community members to reach out and let us know that something is happening before it gets to the healthcare facility, because we know everything starts within the communities. If it's a farmer that's saying that his chickens are unwell, or you might see somebody passing by the beach and see several fish on the beach dead, or you find that, like I said, you went to a party, a lot of persons are feeling unwell, or you might have two deaths, sudden deaths in a family, all of a sudden. So these are the little things that are very unusual, that need investigation. It's not everything, but something that you find that is unusual. And again, we will be putting up the posters in specific areas in the north and the south, so that persons are more sensitized towards the 311 contact center and can call with their queries. We do try to make sure, well, we make sure that we go through the signals every day, and to be able to give a response in as a quick time as possible. Yeah. I think I strayed a bit.
No, no. So if anybody sees something unusual, they call 311 and let the people at the contact center, the whole team working there, decide what the response should be, instead of saying, oh, that's nothing.
Yes,
Call,
yes,
report it, and you guys will do the necessary as
yes,
necessary.
yes, as this
Right?
is, that's exactly
So,
what the poster says. Call, report.
okay. Great. So, Dr. Gomez, it was nice having you with us. I'm sure you didn't realize the time went by so quickly.
No, didn't.
Thank you. It was very, very informative. And I hope that, we will get on stream with that 311 contact center, and you will be getting more calls from the community, so that that event-based surveillance system can really kick into high gear, and we can do the necessary to prevent, as you said, the outbreaks that are possible if we don't get those things sorted out early enough.
Yes,
So,
yes.
is there anything you would like to share? As we close, we've come actually to the end of the program. So,
Um, well,
any last words?
I think I've shared just about everything. I just encourage the public to reach out to the contact center and report anything unusual that you see. We're there here to serve. We're here to prevent diseases because in the end, our goal is to keep St. Lucia as healthy as possible. It's better to prevent than to treat the diseases. Yes?
Okay. Thank you so much, Dr. Gomez. Have a wonderful day, and we look forward to you joining us again at some other point in time.
Yes. Thanks for having me.
You're most welcome. And thank you to our listeners for tuning in this morning. Join us next week, same time, 10 a.m. to 11 a.m. on 88.5 Super FM for another episode of Casualty 911.